So we're sticking with the same theme now. So we asked you, what's changed since you were a resident?
Well, I think that in this day, residency is a much more standardized, regulated process. And I think for the residents, regardless of the program that they go to, they're assured of having a more unified curriculum and getting a more complete education. And I think that's much better for them.
Actually, things have changed a lot indeed. When I finished my residentship, open surgery was a standard, and endourology was just at the beginning. We were doing the initial laparoscopy in my country, though nowadays technology and many things have changed a lot. Now we perform endourology, now we perform laparoscopy, and that's for the better management of patients and better recovery, though I think technology and neurology has evolved a lot.
The robot laparoscopy has made everything change. I mean, I didn't train in the laparoscopic era, and coming out into the practice, you were doing everything open, and eventually you had to kind of teach yourself how to do laparoscopy, which I did. Even in a small rural practice, I was able to do that, but then the robot came, and that's a very expensive piece of equipment, so a lot of places can't afford that. So, I mean, I think that's probably the biggest change, is the transition from open surgery to minimally invasive techniques with laparoscopy and the robot.
Prostate cancer, we really didn't have much except for DES and orchiectomy. Now there's myriad medications that you can use to treat metastatic prostate cancer. And not only that, but we have also shown that prostate cancer is much less diagnosed as a metastatic disease. So we've made a huge impact in the patients who have prostate cancer.
Now we're going from the era of treating patients basically on the surface, and we've scratched down deep enough. So now we're looking at genomics and gene pool and seeing what people's risks are for cancer, and deciding not only do you have the disease, but do you need to be treated for the disease.
I'd say one of the biggest changes is just the attitude towards treating prostate cancer and who needs to be treated and who doesn't. A lot of guys who, there had been no question they needed a radical prostatectomy just 6 or 8 years ago. Now a lot of those guys will say, we're just watching them. Maybe they don't need anything done.